The January 6th closure date is looming for Sharon Regional Medical Center, leaving a community without life-saving services. And as the holidays near, many employees are concerned on the security of their job. First News reporter Sharon Gibbons continues our coverage of the closure by speaking to a few physicians on the impact.
What the community is going to be like without this hospital, 100%. So it's going to be devastating.
Many, if not all, Sharon Regional Medical Center doctors are scared for the future of the community if the closure happens. The loss will impact those seeking healthcare services, nearby hospitals, and the hundreds of those still employed at Sharon. Chief Medical Officer Dr. Nick Abbott says if the closure happens, the gap will not be filled by another local hospital.
They will not, expand services to provide something like that. So the closest intervention that someone could have is at least 30 minutes away, which literally would be life or death a lot of the times.
Sharon Regional is the only accredited cardiac and stroke center in Mercer County, and any delay in care is putting lives at risk.
Heart disease is still the #1 killer of Americans today, and that is what we specialize in at Sharon Regional, for sure. In addition to that, we have a whole other cadre of services that would be impactful to the community.
Dr. Chinedu Igwe saved one man's life days ago by giving him an emergency cardiac stent, and he would not have survived the transfer to another facility. She says one advantage of Sharon is the history they have with the community.
They're not coming from far away, so you already know the backstory. So that makes it a lot easier to treat them. Now, if we get all these patients down, hour away, other hospitals, these records are going to get lost.
Sharon is also the only hospital that offers in- and outpatient psychological and behavioral health services for adults and adolescents in the area, serving hundreds in outpatient services and an average of 25 people in the inpatient facility. Dr. Wally Novero says the lack of services will hurt the community mentally and economically.
People with mental illness, a lot of bad things can happen from that. Increased crime, increased homicidality, increased suicidality, increase people to be able to go to work.
The plan to save the hospital fell through when Meadville Medical pulled out from the deal, citing a lack of financial support. Chief of Medical Staff Dr. Shiro Najawin says the Buell's Foundation lack of financial support has been disappointing.
And in a very good position to help us out now at this time to buy back the hospital, put it back on the right track. And it was very disappointing to me that they were unable to put this money in, or they felt unable or unwilling to put this money in for the sake of the hospital.
Dr. Najawin tells First News that Tenor Health is interested in taking over operations and will be making a case to the Commonwealth on Monday. With First News, I'm Sharon Gibbons.
Hi everyone, I'm Lindsay Watson. Thanks for watching the WKBN 27 First News YouTube channel. If you want more video news, subscribe to our channel. And don't forget to download the WKBN 27 First News app for breaking news alerts.